The next question I got was about growth curves. My child's at the 3rd percentile. My provider said not to worry, but I'm worried. And let me tell you, you're not alone. Parents ask me every day what percentile their kid is in, and I ask my child's pediatrician too. But as a provider, I think that growth curves can be kind of confusing. So let's talk about what they are. Growth curves are a graph of body size over time. Typically, we think of higher numbers as better, but for growth curves, that's not the case. The 50th percentile means we expect 50% of kids to be above this line and 50% of kids to be below this line. Now, as your child's an infant, we look at growth curves all the time. Their job as a baby is to eat and grow, and so it's fun to track that and to make sure that they are getting enough calories and feeding okay. Now, as your child gets older, 1, 2, 3 years old, their growth slows down a lot. And so I don't necessarily look at what percentile they're in, but more look about the trend of their growth over time. Now, a little variation in this number is totally normal, and you see this as a parent. Your kid can be in the same clothes for months, and then boom, nothing fits, so you have to go shopping. There's a growth spurt, and that's the normal variation that we see with growth. Now, when I look at a patient's trend over time, I'm looking, are they kind of staying in the same range? Or are they accelerating in their growth or decelerating? So going up in percentile or down in percentile. When I see a kid that is growing at the 3rd or 5th percentile, no, this could be normal, but there's a few things I want to look at. First, what's their growth trend over time? Have they always been following in this range, or is this a change? Second, I look at the size of the parents. Parents who are 5'4", 5'6", probably won't have kids that are 6'4". And so if parents are in a certain height range as an adult, I would expect their child to grow pretty close to where their parents are. Now, the last thing I want to do is ask you a ton of questions about how they're feeding, peeing and pooping, sleeping, developing, and then do a full exam. If all of that is normal or reassuring to me, I would watch closely. That's why it's so important to go to those well checks so we can plot your child's growth over time. And sometimes I even have kids come back sooner just so we can get a little bit more data about their growth. I think this question brought up something really important. If you as a parent have a concern or worry, as a provider, I'm worried too. So if you still have unanswered questions or you feel like you don't really understand what your provider's talking about, let them know. I always want families to stop me and say, that doesn't make sense, or can we keep talking about this? Because I know that we use a lot of medical jargon and it can get pretty confusing. So any time that you feel like you have more questions for your provider, let them know.